Dr. Fitz here with an update. It's been almost a week and we're just so really pleased with the numbers and everything that's been going on. Last time we talked about the death rate, the mortality rate, and the CDC along with Dr. Fauci and the guys on TV have cut all of their projections in half because you guys are doing it. You're doing it, you're doing it, you're doing it. The distancing, the social distancing, the washing the hands, wearing a mask when needed. We can talk about that later. A lot of controversy with the masks. But to make a long story short and really, really important, we are winning. We are really going to beat this, and you're doing a great, great job. Really, really importantly, because testing. So many people are getting tested. We do testing here as well. My beautiful assistant, Zoe, the wife is fine. She's doing fine. Everybody's always asked me. The wife is awesome. My Benim Gazalishim, my beautiful Turkish wife, she's awesome. But she's busy right now, so they didn't want to worry that she's not helping, but Zoe agreed to be my assistant today to help out with the information. So again, this is so important. I've been seeing so much stuff on TV. Hey, why don't you Skype your doctor or do telemedicine? And, that's okay for triage or maybe talking a little bit. But this is an RNA respiratory virus. Breathing. It's a respiratory virus. That one you can't get a pulse ox or oxygen saturation through the phone. So of these things here, very, very importantly, right now with the pollen, my car is green. What else causes some shortness of breath and wheezing? Cat dander, dog dander, pollution, irritants, perfumes, exercise. What we're talking about is right here, this one thing out of all of these that can cause that shortness of breath. Next slide. So all of these things which irritate the lining of the lung. I have asthma, and we're very respectful of this virus, even though we're beating it. The wife has rheumatoid. This is so important. I'm very respectful of the severity of this RNA virus. So we do got to use our head and stop the spread, and that's done by doing the hand washing, distancing, and being very careful, getting tested. And we're going to talk about testing some more, because that river of mucus, this is what all of those things cause. A river of mucus. Common sense. A respiratory RNA virus. Can't breathe. The O2 drops. You got to check a pulse ox. The O2 set, the oxygen saturation, to know when to go to the hospital or see me or go to the walk-in or the ER or not. You can't just Skype that visit. Next slide. What's really, really become incredibly important is that if we can prevent the lung damage of this slide right here, which hopefully we'll have some better copies of all of those other things, the cat dander, the dog dander, the weather, the perfume, the colognes, that causes that river of mucus. But this virus, including this virus, causes epithelial damage to the lining of the lung. That we want to try to avoid. An ounce of prevention is worth a pound of cure. So you've all heard of people that are having symptoms and they've tried some medications and they're improving. The French study, for example, the hydroxychloroquine everybody's talking about, along with the Z-Pak. All that's looking incredibly promising. An amazing New York infectious disease expert specialist, Dr. Smith. You can watch that. It's on our video. It's on our Facebook as well. He's treating active COVID patients in New York. Of all the people that he's given that cocktail to, none of them had to be intubated. Now that doesn't mean everybody's not going to be intubated. That just means that with his trial, he did fantastic. Now, the French doctor has 1,000 patients. That's going to come out in the next day or so. 7 patients died. They were older. The rest of them, only 20 ended up in the hospital. So again, some really exciting news coming out of France with the doctor that found that cocktail and has been using it. The initial 80 patient study and now 1,000 patients. Next slide. So when do you come and see us and get a swab or you're concerned? The pulse ox, the O2, if you're wheezing, if you don't have a pulse oximetry at home, don't know what that is, that little thing we put on your finger, we check your pulse and your oxygen level. The symptoms, fever, cough, fatigue, anorexia, you're not hungry, shortness of breath, of course, and myalgias. That's the old-fashioned term for the grip. the flu back in my day a long time ago was called the grip, like it gripped all your muscles. Those are myalgias and arthralgias. Those things should spur a visit to hopefully whoever you trust to maybe at least get checked out. And again, the pulse ox is the most important vital sign out of all of those. Next slide. So we got more data. We finally have collected a lot of data, and even locally. So if you remember, positive, 100,000 people a day are getting tested. 810,000 out of 1 million are going to be positive for the test. But like it shows right here, they can stay home and they get better. Tylenol, Gatorade, fluids, and they can shelter in place. Just don't infect the rest of us, right? Just use your head and stop the spread. Identify who's positive, isolate, and then the rest of us can avoid getting sick. We just have to prevent everybody getting sick at the same time. Again, using that example, if 1 million people get sick at the same time with the corona, 81% will have a mild course. Tylenol, stay home, fluids, and they just heal beautifully. Fantastic. Like Zoe, young and healthy. I'm old and used up with asthma. I have a much worse chance of getting sick and be ventilated than Zoe. So it's really, really important that we use our head, stop the spread. If you test positive, don't freak out. There's no fear. 81% get better, just Gatorade, Tylenol, stay at home, and don't affect the rest of us. The 15% can get ill, 5% have been ending up on a ventilator. Next slide. This is fantastic. So this is from Pinellas County this morning. This morning's numbers from Pinellas. Out of 380 total cases, we've had hospitalizations 66. So you can do this at home. 66 divided by 380 ended up being 17%, which agrees exactly with this, what we had initially from a week ago when we were educating on that. So of those 66 cases, 88 cases, 66 hospitalizations out of 380 total cases came to 17%, agreeing. Our local statistics have agreed with the initial modeling, so that's really important. Of those, there were 8 people that passed away. So 8 people in Pinellas out of 380 total cases comes to a death rate of 1.8%. So 98% survive. Those people passed on. And normally they were older like me in their 60s, 70s, and 80s. Heart disease, asthma, those are the ones that are succumbing more readily. Next slide. This just illustrates those numbers. 66 out of 380 cases were hospitalized, is that 17%. 8 deaths out of 380 is a 2% mortality rate. Next slide. So this is really, really important. This is the to synopsize and to bring it back home again. You're doing it. You're absolutely doing it. You're winning. They cut all the numbers in half last night as far as hospitalizations, as far as ICU beds that are going to be needed, and as far as respirator ventilators that are going to be needed. By doing the hard work that everybody has done, you should be very proud and actually taking care of our neighbors. It's so fantastic. For many of us, this is a Holy Week. It's Easter, and it's absolutely fantastic that we're taking care of our neighbors and doing it for them as well. The distancing, the washing our hands, the helping them out, going to the pharmacy for an elderly neighbor so they don't have to go. So we can't thank you enough from Pure Life Medi-Spa and Fitz Tropics Medical. We are here. We love you. We have swabs. We've been open. We have to stay open 6 days a week per our normal schedule because we're on the front line. And speaking of that, like Zoe and all of our beautiful ladies here, and these aren't all of them, I have been doing this for almost 30 years. And in 1979, Magic Johnson got HIV. They thought, don't go to med school, don't go to med school. This is done by sweat. You can just touch somebody. You're going to die before you're 30. So I knew what I was getting into. But all of these beautiful girls, these beautiful ladies, here, never missed a day of work, out there putting themselves on the front lines for all of us. They're the real heroes. We can't thank everybody enough for the masks, the lotions, the police bringing us hand sanitizer, and the DuPonts with the mask and the hairnet. Even though I'm bald, that's okay. I didn't take too much offense, that's a joke. But it's really important to hear some good news. You're doing it, you're winning. They've cut everything in half. We're almost there, 2 more weeks. So God bless you, and thank you so much for watching this.